Hi, this is Group 4 and this is our presentation about community-acquired pneumonia. In this presentation, we will be discussing the pathophysiology, risk factors, signs and symptoms, diagnostic testing, clinical management in the hospital, medication management, and complications of community-acquired pneumonia. This is a concept map of community-acquired pneumonia. This map illustrates the links and connections evident within community-acquired pneumonia and symbolises how it can all be interrelated. For example, the concept map shows the relationship between the pathophysiology of community-acquired pneumonia with the complications of the infection and then how this can be managed by medication. In community-acquired pneumonia, as displayed within our concept map, respiratory distress, which is a complication of community-acquired pneumonia, is caused by the inflammatory response, which is related to the pathophysiology of pneumonia, which can then be managed by the use of corticosteroids in regards to medication management. Additionally, another example includes airway obstruction, which is due to mucus production within the pathophysiology of pneumonia, and this results in the occurrence of symptoms such as dyspnea and tachypnea, which then can be managed by the use of bronchodilators, again in relation to medication management. Several other links and connections of community-acquired pneumonia are also able to be discovered within this concept map. However, we'll also be discussing these topics in more depth throughout this presentation. Community-acquired pneumonia is a lower respiratory infection acquired outside of the hospital in the community. This type of pneumonia can be caused by bacteria, virus, and fungi. The most common causative organism of community-acquired pneumonia is a bacteria known as Streptococcus pneumoniae. When causative organisms enter into the lung, this triggers inflammatory responses in the lungs, such as attracting neutrophils, releasing inflammatory mediators, and fibrinous exudates, red blood cells, and bacteria accumulation. When the neutrophils are activated, they engulf and kill the organisms that cause the inflammatory response. As a result, consolidation occurs, which refers to the alveoli being filled with neutrophils, as well as the offending organism and fluid from the surrounding blood cells. This causes an interruption in normal oxygen transportations, hence, gas exchange is decreased. Furthermore, the inflammatory response can lead to increased mucus production, which further results in airway obstruction. This airway obstruction consequently decreases the surface area for gas exchange and the space available for the air to travel through the airways. Due to the decreased gas exchange that results from consolidation and airway obstructions, patients manifest symptoms of hypoxia, such as tachypnea and dyspnea that can cause tachycardia. Moreover, the inflammatory response is responsible, therefore, for majority of the symptoms and signs and abnormalities that characterize community-acquired pneumonia. Risk factors involved with community-acquired pneumonia include being 65 years or older. This is due to a result of their decreased and weakened immune systems. Smoking is another risk factor that occurs due to the prolonged exposure of tobacco smoke, which inhibits the immune response to the bacteria. Alcoholism is another risk factor, and suffering from a chronic disease. This includes chronic obstructive pulmonary disease, cardiovascular disease, cerebrovascular disease, chronic liver or renal disease, diabetes mellitus, and dementia. There are also child-specific risk factors, which include children who are born prematurely, infants and babies, such as those who are breastfeeding, children and people who are suffering from undernutrition, children who have suffered from a previous respiratory disease or suffer from allergies are also some risks that increase the child's chance of getting community-acquired pneumonia. Other risk factors can include immunosuppressive conditions, such as corticosteroid cancer chemotherapy, human immunodeficiency virus, otherwise known as HIV, immunosuppressive therapy, which can occur after an organ transplant, bed rest and immobility, abdominal surgery, which is as pneumonia is a common complication that can arise following this surgery, malnutrition, IV medication use, upper respiratory tract infections, and intestinal and gastric feedings conducted via nasogastric or nasointestinal tubes are also other common risk factors that can lead to a community-acquired pneumonia. Signs and symptoms associated with community-acquired pneumonia include the inflammatory response causing fevers, which can lead to and cause dehydration, shaking and chills, fatigue, dyspnea, pleuritic chest pain, which can be caused by the inflammatory response, which can result in patients experiencing difficulty in eating, which is known as dysphagia. Additionally, a loss of appetite can lead to weight loss and anorexia. Another sign and symptom is tachypnea, hypothermia, particularly in older patients, diaphoresis, fatigue, myalgia, headache, and abdominal pain are also common symptoms. Patients may also experience a cough as dependent on the pathogen. This cough could be persistent and dry, and it may produce sputum, which may appear as green, yellow, or rusted coloured and bloody. It is usually caused by an increase in mucus production. Consequently, cough and sputum production can also result and lead to respiratory failure. There are several diagnostic techniques which are able to be used to diagnose community-acquired pneumonia. The most standard and commonly used tests include a thorough review of the patient's medical history, a detailed physical assessment, and a chest X-ray. These three assessments used are usually enough information to diagnose a patient with community-acquired pneumonia. By analysing a chest X-ray, inflammation can be identified in the patient's lungs and is one of the main indicators of the presence of pneumonia. Moreover, another consideration can be the use of a sputum sample and gram stain, which can identify the infectious organism causing the community-acquired pneumonia and should be done prior to the administration of antibiotics used as the treatment. Also, if the presenting patient is considerably sick and ill, an interior blood gas analysis can be used to diagnose and assess for potential hypercapnia, acidosis, and hypoxia. It can also be used to identify present biological markers, including increased levels of C-reactive protein and procalcitonin within the body. It can thus be used to help diagnose and guide treatment methods for pneumonia, not just for the diagnosis. A pleural fluid culture can also be collected from the pleural space between the lung and chest walls, which can be tested for the presence of bacteria, thus indicating the presence of pneumonia, if positive. A bronchoscopy procedure can also be used to diagnose and identify the extent to which the lungs have been affected by pneumonia, and therefore lung samples can also be collected to identify a possible cause of the infection. Furthermore, a chest computed tomography scan can also be used to diagnose and illustrate the extent of damage in the lungs as caused by the pneumonia. Moreover, a CT scan can also be used for more detailed lung imaging. Ongoing blood tests are also able to indicate the presence of elevated white blood cell counts and may be an indication and a sign of an ongoing infection.
There are many ways to clinically manage patients with community-acquired pneumonia in the hospital. Firstly, assessment is part of the clinical management, as it can identify changes and further decompensation of the patients. For example, nurses can complete full respiratory assessment to assess respiratory patterns and the signs for airway obstruction. Also, abnormal lung sounds and the amount of airflow can be identified through auscultation. Vital signs, especially respiratory rate and oxygen saturation, should be monitored frequently as well. By assessing the patients, it is easier to find out what kind of management will be appropriate for the patients. Also, nurses are able to detect the early signs of deterioration. Therefore, patients can be clinically managed in a way that can prevent the patients from getting worse from community-acquired pneumonia. Moreover, assessment helps to figure out if the intervention was successful, such as the medication administration. Secondly, various supportive care can be provided to the patients. One way is to assist patients to a position where their heads are elevated and flexed, so they can minimize respiratory efforts and reduce the oxygen needs. Encouraging the patients to change their sitting position frequently is also recommended. Secondly, healthcare professionals can provide education on how to deep breathe, such as the use of quad and half techniques. Also, instruct patients to inhale deeply and cough after exhaling slowly. By doing this, patients can effectively cough, therefore can have a clear airway to breathe efficiently. The third clinical management is to provide oxygen therapy. The administration of supplemental oxygen is essential elements of appropriate management for the patient with community-acquired pneumonia. It is commonly prescribed for the patients with pneumonia to treat or prevent the symptoms of and manifestations of hypoxemia, for example, cyanosis, agitation, headache, and nausea. Oxygen therapy should be discontinued if oxygen saturation level is above the target range or as ordered by physicians. This is because complications may arise due to long-term use of oxygen therapy, as oxygen administration can cause structural damage to the lungs, especially in patients with pneumonia and COPD. Nutritional therapy is also one of the strategies that can be used for patients with pneumonia. The first one is fluid management, which is to encourage patients to drink at least 3 liters per day for the compensations of fluid and electrolyte loss. As a result, it can prevent patients from getting dehydrated and also to loosen the secretions that are sticky, so it's easier for the patients to cough up. Fluids can be given via oral, and if oral pathway is not possible, nutrition can be given via IV. However, it is important to monitor fluid intake and have individualized management. This is because large amount of fluid intake can be harmful for some patients, like the patients with heart failure. Also, it is encouraged for the patients to have the intake of at least 6,300 kilojoules per day to have the energy for increased metabolic processes. Patients with pneumonia show symptoms of shortness of breath and chest pain, which causes difficulty in eating. Due to increased metabolic needs and difficulty in eating, weight loss often occurs. With these reasons, small and frequent meals that are high in kilojoules and nutritious are easier and beneficial for the patients with pneumonia. Nutritional therapy helps to prevent development of infection, which is caused by malnutrition. Medication intervention is the common method to manage community-acquired pneumonia. The primary goals of medication therapy for the patients with pneumonia involves eliminating the causative organism, resolving the clinical signs and symptoms, minimizing hospital stay, as well as preventing reinfection. The commonly used medications include antibiotics, corticosteroids, antipyretics, analgesics, cough suppressants, antifungal medications, and antiviral drugs, and the uses of them will be discussed further. Antibiotics reduce the occurrence of adverse effects and development of drug resistance in patients with pneumonia. Antibiotics either destroy the bacteria or slow down the development of bacteria by disturbing the structural process in the bacterial cell. This reduces the inflammatory response caused by bacteria entering into the lungs. The examples of antibiotics are amoxicillin and gentamicin. They are used to treat mild, moderate, and severe community-acquired pneumonia. Corticosteroid drugs are the anti-inflammatory medications that help to reduce the inflammatory response in the lungs. The examples of this drug are hydrocortisone and methylprednisolone. Bronchodilators help to relax the smooth muscles in the lungs and dilate the airways and helps to improve breathing. The examples of bronchodilators include salbutamol. Antipyretics help to reduce fever and analgesics help to reduce the pain, and examples are ibuprofen and aspirin. Cough suppressants work by inhibiting the cough center in the brain and also helps to loosen and move mucus out from the lungs to reduce airway obstruction. Dextromethorphan and codeine are commonly used drugs for pneumonia management. Antiviral drugs such as ribavirin are usually prescribed to treat viral community-acquired pneumonia, and they work by inhibiting viral DNA synthesis. Antifungal drugs like fluconazole are prescribed to treat fungal community-acquired pneumonia, and they work by stopping fungal cell membrane development. There are a number of complications that result from community-acquired pneumonia. Acute respiratory distress syndrome is an inflammatory lung injury which occurs when alveoli is filled with the fluid, resulting in low oxygen levels. This causes patients to experience shortness of breath and fatigue. Respiratory failure occurs when the lungs are not able to exchange oxygen and carbon dioxide because the lungs cannot release sufficient amount of oxygen to blood. This occurs due to consolidation, which is the process that alveoli are filled with fluid, resulting in the reduction of surface area for gas exchange in alveolar walls. Pleurisy can occur, which is the inflammation of the pleura. Pleural effusion is another complication, which occurs when excess fluid is collected between the visceral and parietal pleura. Empyema occurs as a complication of pneumonia, which is a collection of pus, or the infected fluid, in the pleural cavity. Sepsis can occur when the bacteria is spread from lung tissue to the blood circulation of the body, and it can damage multiple organs, including lungs. Atelectasis is one of the most common complications that can be seen from the patients with community-acquired pneumonia. It is a partial or complete collapse of the entire lung or the affected area occurring due to fluid buildup in alveoli field. Lastly, patients can have damage to kidney, liver, and heart, and this is a long-term complications of community-acquired pneumonia. When patients are not able to effectively breathe due to obstructed airway, our vital organs are unable to have sufficient oxygen to work for their own functions, therefore causing damage and inhibit the proper functioning of our vital organs. This was a concept map presentation about community-acquired pneumonia by Group 4, and thank you for listening.